Buckle up, everybody, because it's something we all hope to avoid, but really need to understand. Car accident injuries.
Yeah, it's one of those things you don't really think about until, well, you have to.
Exactly. I mean, look, over 3 million people are injured in car accidents every year, just in the U.S. It's a lot.
It is. And I think what's really important for us to get into today is that it's not just the big dramatic crashes that cause lasting damage.
Right, like those ones you see in movies.
Yeah, exactly.
Yeah.
Even a seemingly minor fender bender can set you up for years of pain and complications.
Okay, so let's break this down. First of all, why is it that something like a fender bender, where you might walk away feeling like, okay, I'm good, can actually be so dangerous long term?
Well, think about it. When you're in an accident, your body kicks into survival mode. Adrenaline's pumping, you're probably a little shaky, but you might not actually feel that much pain right away.
It's like your body's own painkiller.
It is. But that doesn't mean there's no damage. In fact, some injuries don't even show symptoms for days, weeks, or even months later.
Okay, so that's pretty scary. Let's talk about some of these specific injuries, and I think the one that probably comes to mind for a lot of people is whiplash.
Yeah, classic car accident injury.
Right, but most people probably think of it as, like, a sore neck. Is that really all it is?
Well, it can definitely involve neck pain, but it's actually much more complex than that. Think about the forces at play in a sudden stop or impact. Your head is whipped back and forth violently. And that can affect a very important nerve called the greater occipital nerve.
Okay, and that's...
This nerve runs up the base of your skull and is responsible for all sorts of sensations in your head and neck. When it gets irritated or damaged from whiplash, you can get these incredibly intense chronic headaches that just won't quit.
So not just a sore neck, but potentially chronic pain.
Exactly, and it doesn't stop there. Those headaches can lead to sleep problems, trouble concentrating, even sensitivity to light and noise. It can really impact your quality of life.
Okay, wow. So we're already seeing how something that might seem minor at first can have these ripple effects.
Right, and that brings us to another really sneaky injury. Concussions.
Yeah, concussions and traumatic brain injuries, or TBIs. Those sound a lot scarier.
They can be, but the tricky thing about them is they're often invisible.
You mean you can't, like, see them on an x-ray or something?
Right, and the symptoms aren't always obvious.
So you might not even realize you have one.
Exactly. People tend to think of a concussion as getting knocked unconscious, but that's not always the case.
So what should people be looking out for?
Well, some common signs are feeling foggy or disoriented, having trouble remembering things, experiencing mood swings, or feeling more irritable than usual.
These can show up later too, right?
Yeah, sometimes not until days or even weeks after the accident. That's why it's so important to pay attention to any changes you notice in yourself or your loved ones after an accident.
Okay, so we've covered head and neck injuries. What about further down the body? Back and spinal injuries? I imagine those are pretty common too.
They are, and they can be incredibly debilitating. Think about it. Your spine is basically the central support system for your entire body.
Right, it holds everything together.
Exactly. So when you have a sudden impact, like in a car accident, it can put a tremendous amount of pressure on your spine. One of the most common injuries is a herniated disc. This is where the soft, jelly-like center of a disc between your vertebrae bulges out or even ruptures.
Ouch, that sounds painful.
It is. You can have excruciating pain, numbness, tingling, even weakness that radiates down your legs. And depending on the severity, it can take a long time to heal.
So something that starts as like, oh, my lower back is a little sore, could actually be a much bigger deal.
Absolutely. It's always better to err on the side of caution and get checked out by a doctor if you're experiencing any back pain after an accident.
Okay, good advice. What about those injuries that are a little less dramatic, but still super annoying? Like sprains and strains.
Yeah, those are what we call soft tissue injuries, and they can be surprisingly disruptive.
Define soft tissue injury for us, Jackie.
This is a medical term that is mostly associated with auto accidents and caused by hyperextension of the ligaments, tendons, or muscles of the neck or back, and these can be painful and serious.
A sprain is when a ligament, which connects bone to bone, gets stretched or torn. A strain is when a muscle or tendon, which connects muscle to bone, gets stretched or torn.
Okay, so basically you've overstretched something.
Yeah, exactly. And depending on the severity, these injuries can take weeks or even months to heal properly.
And I imagine if you don't let them heal properly, you could be setting yourself up for problems down the road.
Exactly. Scar tissue can form, which makes the area less flexible and more prone to re-injury.
Oh, so you could end up with chronic pain or stiffness.
Right, and that can really impact your mobility and your ability to do the things you enjoy.
Right, and then of course there are the injuries that are a little harder to ignore, broken bones.
Yeah, those are definitely more obvious. Ribs, arms, legs, all vulnerable to the forces of impact. Often it's actually the seatbelt or airbag that causes the fracture, which, those safety features are there to save your life, but they can still pack a punch.
So we've covered a pretty wide range of injuries here, and it sounds like even if you feel relatively okay after an accident, getting checked out by a doctor is absolutely crucial.
Absolutely. Early diagnosis and treatment can make a world of difference in terms of preventing long-term complications.
But why? Why is it so important to get treated early, even if you're not feeling that bad?
Well, for one thing, early treatment can help reduce pain and inflammation. Think about a sprain, for example. If you start rice rest, ice, compression, elevation right away, you can minimize swelling and help that ligament heal faster.
Okay, so it's like giving your body the best possible chance to recover.
Exactly. And with things like concussions, early intervention can help prevent further brain injury.
Makes sense. But what if you wait? What are the potential consequences of delaying treatment?
Well, you could end up with chronic pain that never really goes away. Yeah, and you might develop stiffness or limited mobility that makes it hard to do everyday activities.
Crazy making, okay? It can make you start to live in this state of fear where you don't know, right? You're just going to go reach for something and you're going to get this sharp shooting, right?
I imagine that could even affect your work or your hobbies.
It definitely can. And then, of course, there's the possibility of the injury getting worse and requiring more extensive treatment down the line.
So early treatment is almost like a preventative measure. It's not just about fixing what's already broken, but about minimizing damage and maximizing your body's ability to heal properly. There's one more thing I wanted to touch on. In our research for this deep dive, we came across some information about alternative treatments for car accident injuries.
Oh, yeah. Things like chiropractic care, acupuncture, massage therapy.
Right. What's the deal with those? Are they legitimate options?
They can be, absolutely. These therapies can be really helpful in managing pain, improving mobility, and supporting the healing process.
And just by squeezing every time that I release, there's fresh blood that moves into
Supporting the healing process.
So it's not necessarily about choosing traditional medicine or our alternative treatments, but maybe finding a combination that works best for you.
Exactly. It's about finding what works for you and your specific needs.
Okay, so I think we covered a lot of ground here, but the main message I'm hearing is don't underestimate the potential impact of a car accident, even if it seems minor.
Couldn't have said it better myself.
And if you've been in an accident, get checked out by a doctor, even if you feel okay. It's about protecting your health in the long run.
Absolutely. And don't forget, accidents can be traumatic experiences, both physically and emotionally. So if you're struggling with anxiety, flashbacks, or any other emotional distress after an accident, please don't hesitate to reach out for professional help.
Right. Take care of your mental health, too. I think that's a great place to wrap up. So, folks, drive safe out there. And if the unexpected happens, remember what we've talked about today.
Be good to yourselves.
See you next time.